Absolutely. Absolutely.
And you were anxious to get it on the road.
Absolutely.
So
and
you
it
could
was
get...
almost to the point where I bugged him so much about going back to work, and he said, this is not normal.
Yeah.
I said, well, I'm not normal. I'm not like most people.
Next time I see him, I'm going to ask him, is Sandy normal?
But he is absolutely awesome.
Well, I'll tell you what, we have him on the radio here quite often, and it's one interview I always look forward in doing or listening to whoever is doing it, because, he doesn't have that doctor atmosphere. I don't know what that is. Maybe everybody else has gone through that, but he doesn't have that higher than you are personality.
Right. He's very down to earth and so kind.
Yeah.
Just absolutely so kind.
I was impressed with him that my wife's had 2 surgeries and still has pain. And I was amazed that he got the MRIs or X-rays or whatever they are, and he said, I was with her, said, the 2 of you stand up, let me show you, let's look at this.
Right.
And then he pointed out, and it was obvious we could see some problems, and we've never seen this before. But and I was looking at one down below, and I thought, well, that's into that sac or whatever that is, that spinal area that where they give the epidural, and I also didn't know that the spinal cord didn't run all the way to the bottom of the backbone, and he showed us where that stopped. But he pointed out the different things, and he said, now this lower part, he said, we need to look at that from a different aspect, because she already had stainless steel shop work done in there.
Exactly.
Black & Decker had already been there.
Yeah.
And he recommended a different method for that. So we came away from there, like you, very impressed that he took the time to go over every detail and to show us what needed to be done.
He wants his patients to understand exactly what he's going to do.
Yeah.
And like I said, I've worked in the hospital for a long time, but I didn't know exactly what all it consisted of, but I'm telling you, he wants his patients to be schooled on what he's going to do.
Right.
And he tells you right up front, how it's going to be and what to expect, and he's very informative. I can't say enough good things about him.
Well, I interviewed him one day, and when he had back surgery, he said he described the same thing, the fears. What if I don't wake up?
Yeah.
What if I wind up paralyzed?
Right.
So he had the same fears that you had.
Right.
And so he's been there.
Yeah.
And he's been on the other side of that.
Exactly.
That surgery. There.
Means a lot.
Absolutely. And of course, Heartland Spine, Dr. Frank Hayward is who we're talking about. He's got locations here in Cape and in Marion. Girl, you know the locations.
That's exactly right. So be sure and get in touch with Dr. Frank Hayward at Heartland Spine if you are having any problems with back or neck pain or numbness or tingling in your arms or legs, fingers, feet. Just give him a call and visit with him, and I think you'll come away with a much better appreciation and a lot more knowledge, definitely.
You'll be like Sandy. Sandy, I'm real proud you came this morning. I'm writing your name down. The next time that I am brought in there on stretchers at the emergency room, I'm going to say, where's Sandy?
They'll find me if it's between 7P and 7A, Tuesday, Wednesday, Thursday.
Oh, bless your heart.
I'll try to come during those hours.
All right, then.
Well, thank you so much for coming and sharing
part
of your morning with us. And we'll get you back down here one of these days.
All right.
And congratulations.
Oh, like I said, he's my hero.
All right. Thank you so much. That's Sandy Morton. Appreciate you coming in and sharing those words with us.